I'm Jenna Miller. It is estimated that doctors of chiropractic treat more than 35 million Americans each year. This includes the adjustments of both adults and children. Even infants can benefit greatly from chiropractic adjustments. Many times a chiropractic visit is the result of an injury. An injured patient is 28 times less likely to undergo spinal surgery if the first point of contact is a DC rather than a surgeon. And while you may be tempted to adjust your own back or that of your friends, it's important to know that chiropractors must complete thousands of hours of classroom, lab, and clinical internships during their graduate school program. Chiropractic care is our topic tonight on Doctors on Call with our guest, Dr. Shelby Darnell of Restoration Health and Chiropractic.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from at Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.
Dr. Shelby Darnell DC grew up in Plainville, Kansas. She earned her bachelor's degree in human biology and her doctorate in chiropractic from Cleveland University in Kansas City, College of Chiropractic, and graduating cum laude. Dr. Darnell earned her 100 hours of functional medicine and chiropractic family practice from the ACA Council on Diagnosis and Internal Disorders. She has completed more than 300 hours of postgraduate study of diagnosis and treatment of internal disorders. Dr. Darnell recently expanded her chiropractic offices to include Plainville, Stockton, and Phillipsburg. She has also served at Casey Corps and Overland Park Regional Medical Center. Give us a call at 800-337-4788 toll-free with your medical questions about chiropractic care today on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician or chiropractor. We'll wait for those first calls to come in. Thank you so much for joining us this evening, Dr. Darnell. First of all, let's talk about when selecting a chiropractor. What do you find are important qualifications?
Really, any chiropractor will probably do an adjustment depending on what type of chiropractic adjustment they do. Some use an activator, some do more of a diversified adjustment using their hands, putting thrust into a joint. So depending on what you're looking for, if you like a gentle chiropractor, you can look for that, or depending on the techniques will help you choose who you want to see.
Okay, you mentioned an activator. Let's talk about what that is.
It's a spring-loaded tool that is very specific to a joint. So rather than the normal thrust that you get, it's just basically it sounds like a click, and it just kind of clicks on the vertebrae or whatever joint you're trying to adjust, and it's very gentle.
Now, in your practice, can a patient choose whether they want the thrust or the activator?
Yes, they can.
Absolutely. Okay. And why would a person choose chiropractic care?
Any aches and pains that a person has, a chiropractor can typically deal with, whether you've had an injury or if you've had a gradual pain come on from anything that you do from day to day, you can seek chiropractic care.
And we mentioned in the intro that sometimes chiropractic care can avoid surgery. How can that be?
Depending on what is going on, I'm going to use carpal tunnel for an example. Sometimes they do a carpal tunnel release and cut the fascia or the ligament that is covering the that carpal tunnel. Sometimes that pain is coming from tight muscles in the forearm, causing that pain right here because of adhesions that have built up. So sometimes doing the muscle work will actually relax that muscle and relieve that pain.
And you do a lot with muscle work. Let's talk about how important that is.
Yes, so all of the muscles in the body attach from one bone to the next. And depending, like I'm saying, what you do on a day-to-day basis, those muscles can get tight and you can have an imbalance of those muscles. So what I do is called myofascial release, and it's a long sustained pressure on a muscle and trying to break up any adhesions that have occurred that have caused a shortened and tightened muscle.
Okay, excellent. Now, what kind of training and education, we were talking about the 1,000 of hours that a chiropractor has to go through.
Yeah.
Let's talk about that and what's required to become a doctor of chiropractic.
In order to apply for the chiropractic program, usually a bachelor's degree is required. And then once you get accepted to the chiropractic college, you have 4 more years in a graduate program.
Okay. Now, do you ever find people are, I don't know, sometimes I think there's a stigma that chiropractors aren't doctors in a way. Let's talk about that stigma and why it's false.
Yes, so the word doctor is a doctorate degree, and you can have a doctorate in medical, like a medical doctor degree, or a doctorate in pharmacy. And so technically, yes, they're all doctors. We've just gotten to the stigma of just MD, a medical doctor is a doctor.
Okay. Now, something you've been doing recently is hair tissue mineral analysis. Can you tell me what that is?
Yeah, so the hair tissue mineral analysis, referred to as HTMA, is an analysis on a piece of the hair, and it will tell you what the mineral composition in the hair is. And that shows us specifically 4 minerals, the main minerals: magnesium, sodium, potassium, and calcium, but it also shows a lot of smaller minerals and any heavy metals that possibly you have in your body.
Okay, so tell us what the hair reflects.
Okay, it reflects those minerals as well. And the reason that can be an important thing is that those minerals are sort of like the spark plugs in all reactions of your body. And so what we're looking at, what those minerals will tell us, is how your metabolism is going. So you always hear people say, I have a slow metabolism, or I have a fast metabolism. And that can show us basically in the patterns of the ratios of those minerals how you are doing.
Okay, now, is it similar to blood testing, or is that different?
So the hair minerals will actually show us a longer period of time. It can show up to 6 to 8 weeks of activity, versus taking blood will show you a snapshot in time.
Okay, and why test for the minerals? Why is that important?
Like I was saying, minerals have an impact on all reactions of the bodies. And so when you have an imbalance, that can really throw things off.
And what causes that mineral imbalance? Do we know?
Yes. So stress is one of the largest factors in why a mineral imbalance happens. Diet can also be the nutrition that you're ingesting. Medications can throw that off as well.
And tell us about the testing. What does a patient have to do to get to submit those tests?
Yes, and that's a big thing too. The difference between blood and hair is because the hair is a lot easier to test. So you actually, it kind of sounds scary at first, but you will cut, we take a sample from the closest part to the scalp, and usually in 4 different locations in the back where it won't be seen. So we're not going to take them right here. We're usually going to take it from the back, and we cut at the scalp, and we use the first 1.5 inches of the hair because that is the most recent hair coming out of the follicle.
And who would you suggest is in need of if somebody out there is interested in this, who might be a good candidate for this test?
For any types of complaints or symptoms you're having that you're not getting any answers for, I like to put the like a blood test and hair test together, and we try and find the root cause of what's happening. A lot of times migraines can be one of the things that we test for, a lot of hormone imbalances, fatigue, anything like that.
And once a patient gets their results back, then what?
Yep, we sit down and look at the results, we look at those ratios, and we make changes as needed. That could be supplementation, that could be things you do on a day-to-day basis, your nutrition, anything like that.
Okay, excellent information. We want to remind our viewers that we're here with Dr. Shelby Darnell talking about chiropractic care. I just finished talking about the hair analysis, and I did want to ask, what got you interested in doing these testing?
Yeah, a lot of times I like doing my own research online, and so I have just kind of gone down a rabbit hole of a more holistic approach and finding answers. you hear so many people talking about, well, I'm struggling with this, but I can't find an answer. I'm told it's, I don't know what's going on, or it could be this, and I'm just not finding answers. So the hair mineral analysis, I was looking into metabolism and stuff like that, and that's how I found.
Excellent, very good. Okay, according to your website, you spend 30 minutes with each of your patients. Can you explain why your appointments are so extended?
Yeah, so we focus on you and how you're doing. The initial one takes a little bit longer, typically around 45 minutes to an hour. And then afterwards, it's about 30 minutes. We check and see how you've done since your last appointment, make sure you haven't had any more injuries or any new complaints. And then we start with the muscle work typically and do about 15 to 20 minutes. It depends on how many areas you're struggling with. And then once we get the muscles relaxed, then we'll do the adjustment and anything else that needs to be done.
Now, is it comparable to a massage for those who aren't used to haven't heard about the muscle work before?
Most similar to a deep tissue massage. However, I find that I go a little bit slower through the muscles and really spend that time trying to re-lengthen those muscles.
Okay, and why is it so important to do that muscle work rather than just go right into the thrusting?
Yep, because depending on what you do, those muscles will tighten up over time. And we're trying to adjust the joints that are in between each bone or vertebrae. And so if we have a muscle that is attached to that bone, pulling on it, it can fixate the joint. And so we really want to make sure we take that tension off of that joint before we adjust it.
And what might a patient experience in that initial appointment?
Yep, so we come in and we go through the initial paperwork. The paperwork is pretty extensive because we need to know exactly what could be causing your pain, any previous history, any surgeries, medications, in order to come up with a diagnosis. And so in order to make that diagnosis, we do any orthopedic exams that we need to. We'll do some range of motion testing if needed, and then we will go ahead and do the treatment if you are a chiropractic candidate.
Now, we mentioned earlier about the children and even infants that can benefit from chiropractic care. Do your appointments with them differ from adults, or is it about the same?
Yep, it typically is shorter. The most common complaints we have with infants could be colic. Sometimes infants get torticollis and they can actually start to get a flat spot on the back of the head. And so we can help loosen any tight muscles or anything like that in order to allow that baby full range of motion, turn their head, and help with preventing those flat spots.
And speaking of colic, how does chiropractic adjusting help with that symptom?
Yep, the fussiness, sometimes you don't really know where it's coming from. So we can adjust and see if that can help that baby in any way get out of pain or any irritation or irritability that it has.
Excellent. And something else that I think is maybe thought of chiropractic care is that you have to continue to keep coming back on a regular basis. What do you have to say about that?
It depends on what you do day in and day out, because if the pain that you are experiencing is because of, say you're working, if you work a desk job and you have that neck tightness, if you're doing that constantly, it's going to take a little bit more time to get rid of that. But we also need to look at posture and things that we could correct to prevent it in the first place. And so if we can avoid the activities that are irritating and then also get rid of the pain with the muscle work, we can decrease those visits and the need for those visits.
And speaking of those individuals who might have a desk job, or their job requires them to maybe be sitting more than being active, what can you say to those people that might help them in their situation?
Yes, I always suggest heat to the areas of discomfort because that will get good blood flow back to those muscles. We want to do some stretching practically every day, and then if it's possible, get up about every hour and just move around so you're not in the same position for a long period of time, and really focus on your posture, bringing your shoulders back, sitting up nice and straight.
And what is the difference between using heat rather than using ice?
Yes. So when you put ice on your body, you are going to take away the blood flow to an area, which is great if you're trying to reduce swelling. But whenever you're trying to relax a muscle, you want to use heat because that will return the blood flow and allow that area to relax.
Now, sometimes you'll hear 15 minutes heat, 15 minutes ice. Is there any truth to that?
Yeah, so if you are going to do ice and heat at the same or back to back, it is good for pain relief. However, with more if you're trying to get rid of tension, I would suggest sticking with heat.
Okay. And do you require your patients to have x-rays before you work on them?
Usually no, and that's how we come up with whether you need x-rays in your exam and in your initial intake paperwork. Some people do come with x-ray reports already because they've had it in the past, but they're not required usually.
Okay. And what about insurance? Is any of your appointments covered by insurance?
Yes, it is.
Okay. Now, average, how many times do you treat a patient? I know we had talked earlier about it just depends on what you're working on. Do you, once a month? Do some people like to come back just for a tune-up in some ways?
Yes, I do have some patients that will schedule their 1 month appointment just as a preventative. They say it just keeps them going versus waiting until something happens and then them coming. They just prefer that. If you have an active complaint, it will usually take 2, maybe 3 visits. If you've had a chronic complaint, meaning you've had pain over a long period of time, it's going to take a few more visits.
And do you find that if a patient maybe starts chiropractic care at an earlier age, do they have less problems as they grow older?
Potentially, yes.
Mm-hmm. And how about do you usually adjust your patients the same way?
Not all patients are treated the same. Age will be a factor on that. The little kiddos are going to have a more gentle adjustment. It also depends on any health conditions that you have too.
And what can a patient do at home to try to either build up their muscles or to try to prevent having to come back so often?
Yep. I always suggest some type of stretch or modality that you can do at home to progress you quicker. And then just making sure that if you do any activity, you kind of warm up the area before you do, or stretching, any preventative stretching is helpful.
Excellent. And we had talked about surgery earlier and trying to prevent surgery from happening. Can a person who has had surgery, let's say back surgery or carpal tunnel, can they still come to see you after that surgery is complete?
Yes. Yep. And we'll look at where the surgery took place and what type of surgery, but we can usually adjust above and below the area of surgery.
Sure. And we were speaking also in the intro about people either trying to adjust themselves or trying to adjust a friend or have a friend adjust them. What are the dangers of doing that?
We are taught heavily on what direction to press when we adjust, how deep we should press, how quickly we should press. So there's a lot that goes into the adjustment that some people don't think about. And so if you're pressing in the wrong direction, you can cause an increase in pain. You can give an injury to somebody. If you're adjusting your neck by yourself, you can really stretch those ligaments in the neck to a length that they shouldn't be. So I really would suggest you do not self-adjust.
Mm-hmm, absolutely. And then oftentimes you'll either hear somebody self-adjust themselves and hear that cracking. What is that noise that you hear?
Yep, that pop happens whenever you gap a joint far enough that there's a gas release in that joint, but that does not indicate that an adjustment has taken place, because an adjustment is putting the motion back into the joint and getting that mobility back.
What do you find are the most common conditions that you treat in your practice?
Headache, rib pain, low back pain, and sciatica are probably the top conditions that I treat.
Okay, and tell us what sciatica, what that is.
Sciatica is actually a nerve that comes out of the low back and runs down both legs. And sometimes it can be caused by the SI joint irritation, but it can also be caused by tightness in the glute muscles. And so a diagnosis is important to figure out what is actually causing that pain to get rid of it.
Do you treat a lot of sports injuries?
Yes, actually I do. And one thing that I try and focus on in my practice is what is hurting, what are you doing when it's hurting? So if say a football player comes in and says, it hurts when I pull my arm back to throw the ball, I will do my treatment and then I try and simulate that movement in order to make sure that I have gotten rid of that pain, or at least we're making progress.
Absolutely. Now, another thing that we might sometimes hear about is cupping. Can you explain what that is and if that's something that you do?
Yep. Cupping is just a plastic cup that is typically used on the back, and it will suction up some of the skin and muscle and fascia into the cup, and that releases some tension, and if there's any stagnant blood in the muscle, it will actually pull that to the surface. So you see a lot of bruising with cupping, but that it's not a bad thing, and that just kind of relaxes and releases that tension in the muscle.
And let's talk about e-stim therapy. What is that?
Electrical stimulation is a machine that has electrodes that come out to pads, and you place the pads on the skin where that sends an electrical stimulation into the muscle and fires that muscle, and that's really good for pain relief.
Is that something that you do in your practice?
Yes, I do.
Okay, excellent. And how long does that usually take?
Usually we try and do it for at least 8 minutes, usually between 8 and 12 minutes.
And is it something that can be done while you're doing your muscle work, or is it just solely has to be done by itself?
Yes, I like using it when people have two areas of complaint, say their low back and their neck hurts. I'll put the e-stim on one area and work the other area at the same time.
Okay. Some chiropractors have, I hear about this kinesiotaping. What is that?
Yep, so kinesiotaping is a stretchy tape that you put over an area of complaint on the skin, and that sends neural feedback to the brain to relax that area and to get rid of any inflammation.
Okay, factor. I think you maybe mentioned that earlier. Let's talk a little bit more in depth on that.
Factor is instrument-assisted soft tissue mobilization. So you use a still instrument, and it's kind of like scraping of the surface, but what that does is break up any adhesions that have built up in that muscle or fascia.
Pin and stretch.
Pin and stretch, we will shorten a muscle by taking, like, say we're going to work on a bicep. We're going to shorten that muscle. I'm going to press in on that muscle, and we're going to re-lengthen that. And so that is trying to break up adhesions and get more range of motion going.
Okay, and then hypervolt.
Hypervolt is a massaging tool that uses percussion that is good for pain relief.
And do you use all these different things for a session, or do you just kind of have to decide what was going to work best for which patient?
Yep, I don't typically do all of them in one session. I usually stick with the myofascial release and factor, and then once I adjust, we kind of sit up and see how you're feeling. If we don't quite make the progress that I want, then I'll add something else in. Or if you come in at your next visit and we didn't make the progress that I expected, I'll maybe change what I'm doing.
Do you ever have a patient that comes in and maybe they just want the muscle work done and not the adjustment?
Yes.
How do you do that?
Yep, and that's all in communication. If you don't like being adjusted, we can definitely usually make progress just doing the muscle work, and as long as you communicate that with me, we will change what we're doing. And some people don't want the muscle work, they just want to be adjusted, and I usually will help them with that as well.
Okay. Now, do you find one works better than the other, or just together they work great, or how do you find
I
that?
think together they make the most benefit for patients.
Okay. We were talking about infants earlier. What about pregnant women? Do you adjust them, and how does that work?
Yes, so when mama's growing belly, we get a lot of back pain in order to compensate for the weight in the front. And so a lot of sciatic, a lot of low back pain, and we can definitely help with that. We can also make sure the pelvis and the sacrum are in alignment too, and get rid of any tightness in the round ligament in order for baby to be in the most wanted position.
Okay. We're going to go to the phone lines. We've got a caller, Carrie from Lynchburg. Hi, Carrie. Go ahead with your question for Dr. Darnell.
Yes, I went for a while not going to the chiropractor just because I didn't have insurance and I didn't have the money. And then I finally have been going a little bit more regularly, but I don't know if the damage is already done because I feel like I have to go all the time to get any relief. I've had lower back pain, and I don't have great bedding, but I don't know. Sometimes I feel like if I don't go every other day, I just don't have relief. Do you think eventually that pain will go away? Do you have suggestions of how I can get rid of this lower back pain without having to go to the chiropractor all the time?
I would definitely want to look at muscle imbalances in that situation, because if you feel like you need to go every other day, there's definitely something else going on than just a joint fixation. And so I would see kind of what else is going on there. I would definitely try and look into finding somebody that will do some other modalities and give some relief with the muscles.
Excellent. What about warming up and cooling down? Is that important, even if, let's say, you're not in sports, but you are out working in the garden? Is it important to warm up and cool down for something like that?
Yes, because you want a good blood flow going to those muscles before you're using them, really doing anything.
Okay. Very good. Thank you so much for joining us tonight, Dr. Shelby Darnell from Restoration Health and Chiropractic. On our next Doctors on Call, we'll be discussing pain management. You can email questions to us for our next program at doctors@shptv.org. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.